Thank you. So my name is Eniko Gebri. I'm a dentist, so a bit odd one out from the University of Debrecen. This is the second occasion in the Human Glycome project meeting, but the first occasion when I can present one of part of our research related to dementia. Very briefly, I would like to summarize some important information about dementia, which approximately affects 55 million people worldwide. The most common type of it, Alzheimer's disease, followed by vascular dementia. Everybody knows the most common etiological factors, such as hypertonia, diabetes, obesity, arteriosclerosis, and unfortunately the symptoms such as loss of the short-term memory and personality changes can occur in an advanced stage, so an early and non-invasive biomarker would be groundbreaking. Okay, we find the optimal direction. We also know that aging has a significant effect on the glycosylation, decrease of the galactosylated and sialylated structures, and most studies examine the Alzheimer's disease. In the right side of the slide we can see a glial cell, the AD affected brain region, and there are several glycoproteins which has a well-detected N-glycosylation modification in the AD process. In the left side table, we summarize the most important glycoproteins from brain tissue, specimen, cerebrospinal fluid, and the human plasma. Sorry. Other studies examined other types of the dementia. For example, a research group from Rijeka described several differences between the two main types of dementia. And there are some studies which examined vascular dementia. For example, this study from the Chinese population where 81 patients with dementia were compared and 8 segment healthy controls with normal cognitive function, and they found decreased sialylation and corpusculation and revealed increased bisecting Glycome level. Another study examined 330 patients with arteriosclerosis, divided into further groups. One part of the groups had vascular cognitive impairment, the other group with normal cognitive function, and they also revealed the same results than in the prior study, the decreased sialylation, galactosylation, and increased bisecting Glycome level. So our aim was to investigate the changes in serum total N-glycome profile in patients with vascular dementia compared to healthy controls, and try to identify potential non-invasive biomarkers. We collected not only peripheral blood samples but also saliva and oral mucosal samples from dementia patient, a retirement home in Hungary. The sample collection was performed after a negative COVID rapid antigen test. We classified the severity of dementia using MMSE test, and we choose 7 patients from the 25 examined patients. 3 patients had severe dementia and 4 with moderate dementia, and we compared the dementia patients with age segment healthy controls. There was no significant difference between the average age, and the sample processing method was the same that Professor Anders Gutmann mentioned priorly. During the analysis, we identified 38 N-glycone structures, and 5 structures showed significant difference between the two groups. we signed with red the significantly different structure between the control and the dementia group. And we can see these structures. 2 structures showed significant decrease in the dementia group, and 3 showed significant increase in the dementia group. After that, we determined the xyloform to neutral carbohydrate ratio, the ratio of core-fucosylated structures to the total N-glycosylation, the ratio of the structures with the bisecting gluconate to the total N-glycosylation, and the degree of branching to the total N-glycosylation. And in the figure we can see that the xyloform structures showed significant decrease in the dementia group, while the core-fucosylation increased, and there was no difference the 2 further examined ratio. If we would like to discuss our results, we can tell that there is no relevant literature data reporting on changes in total serum N-glycome profile in vascular dementia, but both in Alzheimer's disease and vascular dementia examine the human plasma IgG and glycosylation changes, and as IgG is the highest abundant protein among the N-glycosylated serum proteins, we can compare our serum results with the previously mentioned studies. If we compare our results with the literature data, we found the similar changes in FA2 structure and the degree of cellulation in the N-glycosylation of IgG, but we found some controversial data which could be explained a small number of our examined dementia patient. So finally, if we would like to conclude our results, we would like to tell that further follow-up studies are warranted, and we would like to amend our research with the examination of saliva, oral mucosal samples, brain tissue specimens, in order to identify a less invasive, non-invasive biomarker for dementia using in a clinical practice. Thank you for your kind attention.